Let's discuss about the hip replacement. In this, we'll be looking at the anterior approach to the hip. Now, we'll be putting an incision over the anterior aspect of the thigh, in between the sartorius and the tensor fascia lata, and in the D plane between the gluteus medius and the rectus will enter into the hip joint. You can clearly see there is the hip joint. There is the diseased acetabulum and the diseased femoral head. Now we are showing the process of safe surgical dislocation of the hip. Now we have to remove the diseased head and the neck. Then we have to think about the acetabulum. We have to prepare the acetabulum for the surgery at first. After removing all the diseased tissue from the acetabulum, we have to check for the acetabular floor. Now we have to put the acetabular cup inside. If the bone stock is good, the cup usually fits in well. Otherwise, we have to use some screws to reinforce this. This is not sufficient to reinforce. We have to use the liner inside it, and there will be some additional support at the posterior superior aspect to prevent the dislocation. Then we have to prepare the femoral canal. After doing the femoral canal, then we have to insert the femoral stem. After inserting the femoral stem, then we will insert the head. As you know, the hip is a ball and socket joint. So after doing all these procedures, then we will reduce the hip joint into its place and we will check for the stability. Thank you. Hope it helps.